Would you start rolling, please, in a couple minutes? Cool, thank you. All right, bye.
Got one thing really high.
Okay, all right. Okay, thanks.
They gave me notice of power.
Hi guys.
Howdy.
How are you?
Give me a few seconds.
Yeah, you betcha. Do we have a phone line that we're supposed to dial into?
I know.
I think the real answer is yeah. Yeah, just let me know when you guys are ready.
That's right. In case you need it.
Hey, so
Just right back there.
Okay, thank you.
we have this. Oh, you're not sure? It's gonna start in a second. 11.
All right.
11.
Can I
It's
get
the
that phone
drone
number?
one.
Okay.
They wanted to do it live.
571 317. Okay.
Can you guys let them know? Because they want to
Over on the table next to the. Actually, we do this.
Okay. So phone number 571-317-3112
You can start here in a second.
and access code 699-141133. All right. Thanks, Greg. Bye.
Okay, what's that number? Go ahead.
Is that live okay?
Hold on.
Hey Matt, sorry, I accidentally called you, didn't need you. I was trying to get a hold of the PIO, but I think I'm all good to go.
Okay. All right. Thank you. Bye. Yeah, dug it all the way up.
There's no number set up for people to call for DOH.
For people from
General
Is that okay? It's gonna
questions.
be okay with battery?
Is it just
To
our
enable
office?
audio control,
now it's
please
just
enter your audio
5500.
PIN followed by the pound or hash sign.
We'll talk about it
If you do
later.
not,
All right, that sounds good. All right, thanks Matt. Okay, bye. Yep.
So the only thing we have is our
then Scott just
Yeah.
hit that.
You guys ready?
Can we get your name and spelling?
Yeah. But you're all ready? Is anyone on the phone?
Yes, everyone's here. We're ready. Go when you're ready.
Okay. Well, good afternoon. My name is Scott Lindquist. I'm a physician epidemiologist for the state of Washington. I'm called the state epidemiologist, and I'm here really to talk about outbreak of measles in the state of Washington. We are now in the midst of an outbreak in multiple counties, and we're up to 26 cases at this point. And I really just wanted to make a point of how infectious measles is and how we're expecting to have more cases across the state, and the concern that I have for kids and anyone who's unimmunized against measles is at risk for getting infected with measles, which, for those of you that don't know, measles is a highly infectious respiratory disease. We have known about this disease for many, many years, and we actually have a vaccine that's highly efficacious against this. But despite that, there are lots of outbreaks in the world right now, and travelers into Washington state are bringing measles to us, and in those populations that are unvaccinated, we can have outbreaks like we're seeing right now. So I thought I'd ask for you guys to give some questions, and I can answer those. Certainly for you on the phone, just interrupt and I'll answer the questions as best I can.
You have the 4 counties.
Yeah, there's only 2 counties at this point, and that's King and Clark County.
Why are the people getting sick here? Shouldn't everybody be immunized?
Yeah, so our best protection against measles is to have immunization, but for those populations that are unimmunized, either for religious or philosophical beliefs, or just have not got vaccination at this point, there are the folks that are at risk for immunization. Remember, the usual dosing of vaccination is 2 doses that usually starts at 12 months of age, and a booster dose given at 4 years of age. Now, we usually have around 5 or less cases of measles a year, so it isn't something we see often, but to have 26 cases is a marked increase in our number of cases.
What's the prognosis of people that come down with it?
Well, you know, this is a question that gets asked a lot. Many people feel like, as myself, I had measles when I was a kid. What's the big deal? Well, the concern is that there actually are a lot of complications that come along with the measles if you haven't been vaccinated. And especially if you're a young child, you're immunocompromised, meaning that your immune system doesn't work, or you're a pregnant woman, these are really high risks for anything from spontaneous abortions to ear infections, severe pneumonia, brain infections, and even death.
Are you expecting it to move north?
Yeah, at this point, it's hard to say. There's a lot of cases that have started in Clark County, and we've now had a case that's linked to those in Clark County and King County. So we are expecting that this is going to move not only through the state, but also through other states.
What are some of the symptoms, and what should someone do if they suffer from some of these symptoms?
Right, and so the complication of this is the early parts of this measles onset can be confused with, you know, influenza or the respiratory viruses we have now. So it can usually start with just malaise and fever, but then there's some real classic parts of measles, which is a rash. And this rash is a rash that starts on your head, usually behind your ears, and then moves down your entire body. And so cough, conjunctivitis, coryza, which is a runny nose, and a rash with a fever are all highly suspect of measles. And you feel miserable.
Can you give any details as to where this person is in King County? Young, old?
Yeah, and so this is a gentleman in his 50s here in King County, and then the demographics of the cases in Clark are mostly kids, the majority of them kids under 21. There are some young adults in this, but mostly kids. Anybody on the phone have any questions? Okay, any other questions?
Once you have them, what is the prognosis of people gonna be just really sick for a while? Is death a problem?
Yeah, so, less than 1% of the people actually die that get measles in the United States. It's much higher if you're in a developing country, upwards of 20 to 30% of people can die in developing countries. But in our country, it's less than 1%. But again, severe pneumonia, ear infections, brain and spinal fluid infections, all these things are complications that can occur. They're rare, but again, most people do well with this, but you do feel pretty miserable. Why these people are a concern to us is because they're potential spreaders of the virus to other people in the community. So when we hear about a case, the first thing we do is try and confirm the diagnosis, isolate the person so they're not out exposing other susceptible people.
And I think there's something where somebody could be in the same room but not even close to you, like an hour or two later, and still come down with it. So how do you?
Right. It's a very tricky disease because even 4 days before you've had this rash, you can be infectious, right? So some people may not even know they have measles. They may not even know they were exposed to it. They themselves are infectious. Like if they were in this room 2 hours before you guys even came in here, you could be exposed to it. If you were susceptible, you might develop measles. And a reminder of how infectious this is. If you have 10 people in this room that were exposed to measles that were susceptible, 9 of those 10 are going to get measles. It's that infectious.
And besides public awareness, are you all doing anything to prepare out of the ordinary for more cases?
Yeah, so obviously the big push is to reach out to folks that have not had the measles vaccine and make sure that they know to get immunized to prevent measles infection in themselves, and all the work that is done. I mean, you can imagine how hard Clark County is working right now, identifying all these people who had a case of measles and finding all the places they had been when they were infectious. So the IKEA, the Costco's, the restaurants, the bowling alleys, all these places, all that work is being done to allow people to know, hey, you were possibly exposed to measles, and if you're susceptible, you really should be seen by your doctor, which is a good point. If someone thinks they have measles, don't go into your provider's office or into the urgent care or emergency room, because you're going to expose all those people in there. What we want you to do is call ahead of time and say, hey, I have these symptoms, I think I have measles, what should I do? And get some direction that way from your provider.
Do you happen to know the last time numbers were this high in Washington State?
Wow, it way precedes me. I'm going to do a call out to a friend here. Do you know when our last case numbers were up in the 30s?
26 now, you said?
Yeah.
We had 30,
Maybe you could repeat it.
we had over 30 cases in 2014.
So, and prior to that, we really haven't, yeah.
No, it was probably in the 90s, early 90s maybe.
Okay, so when the last time we had cases this high was really in 2014, which was an unusual year to have that many cases. And prior to that, it was really in the 1990s that we had cases this high.
So you mentioned the locations where the persons who are infected may have been. Is there any advice to sterilize where those people may have been, or decontaminate?
Yeah, no, unfortunately, that really isn't going to affect the outcome. It's really 2 hours after someone has been in that space, then it's okay to be in there. So like if someone had been at a restaurant 2 weeks ago and is exposed, that should be a safe place to be now, 2 hours after the person has left.
I understand there was someone at a basketball game that may have had it.
Yeah.
How many connections are there from that?
You know, this is the issue. Everyone wants to know, like, who brought this into Washington State and why is it in this population? And I don't think at this point there's any value in pointing fingers at anyone. I can tell you that this has really leaped into multiple basketball exposures, multiple restaurants, healthcare facilities. The best we can say at this point is when we investigate these cases, like in King County or Clark, on their website they are listing all the potential public exposure sites, and if you're concerned about those as a parent or a patient, then that's the best place to look at the known exposure sites.
Good. Great.
Okay, you guys want some action shots or anything? Okay. Thanks for coming.
Thanks for the info.
Appreciate it. Anything on the phone that you need? Okay, great.